optimizing the client experience. There's a solid business case to focus on this, okay? And these are the things I outlined for you. In healthcare, it's the cost, it's the quality, it's the outcome and clinical efficacy and safety. All of those metrics are positively correlated with patient experience. So it makes sense when you actually want to improve your organizational performance overall, that one of the levers that you have is targeting the client experience. Okay, because patients who have a positive experience are more likely to be engaged in their own care, in their own service, and be more compliant. That's the logic about this whole thing. If you enhance the experience, they become better clients. Your organization benefits because it's more cost effective. You don't keep them in the system unendingly. That actually drives up costs. So it's correlated to effectiveness as well. So and the data is pretty compelling. Now I can tell you in the US, the federal government, which is equivalent here to the national government, that pays a lot of medical bills through two programs called Medicaid and Medicare. Medicaid is for the indigent, Medicare is for the elderly. Now it's kind of equivalent to the public health service, but in the public health service here, the national government gives each hospital a budget to operate, and they are provided that care free. Same with DSD. You get a budget and you're supposed to provide that, okay? But in the US, that budget is also linked to client experience or patient experience. So the percentage of funds you get depends on your, in healthcare's case, your patient experience scores. To a large extent dictates how much you will receive. And if memory serves me right, about 10% of your total payment is at risk based on your patient experience scores. And it's exactly the discussion that I had here as well with the Ministry of Health, is that we need to implement the same model here, especially if you're moving towards an NHI, that we start paying hospitals based on patient experience scores. Because you shouldn't just be paying them for services if the patients are not getting the quality of care, and I don't mean the technical aspect, but the total 360 experience that they should be receiving. Okay? So it is a powerful tool. There's a lot of data suggesting that that is the case in healthcare. None of the work of that work is being done in South Africa, but I think this is where the opportunity is for you. I know a lot of you have reached out to me with interest in pursuing studies further. So I'm giving you topics to focus on, defining what client experience means in the social services, correlating client experience to client outcomes, correlating client experiences to cost of delivering services, correlating client experience to staff experience. There's also a positive correlation there, okay? Where patients or clients are more satisfied or have a positive experience, it's more likely that staff has a positive experience. And then you can correlate staff experience to retention, to productivity, etc. as well. So this is a crucially and critically important subject area that is very poorly defined and not studied at all in the context of South Africa. Okay, so let's move to the next slide. And by the please, if you have any questions, put up your hand so we can actually flesh this out as we move along. Because I understand for some of you this may be novel. Okay, so this study by Deloitte, you'll obviously get the slide. You can pull up the slide. And that's one of them. I will also give you another article that was just published in the Harvard Business Review, and it's titled The Value of Experience. Okay, so there's a lot of work being done in this area, zero in the public sector. Okay, and to me, I think that's the big caveat. That's the big caveat, and that's the reason for this negative perception, and maybe justified, maybe not, of the public sector. So we'll post that. But once again, this slide and these articles emphasize exactly the same thing I'm saying to you. There's a business sense to enhancing and investing in the positive, in the patient, in the client experience. Okay, they do better, and the organization does better, and your staff do better. Okay, so there's a case for that. Next slide. Okay, so let's just kind of go into some of the data and some more drill down into this. Let's go to the next slide. Okay, so if you look at this slide, once again, you know, it's just some research by the Beryl Institute, and it kind of looks at some of the component parts and how this is valued by clients. Okay, you can see that there are some people metrics in here and some process metrics in here as well. So one of the highest ranking scores here, the 95%, is do they listen to you, communicate in a clear way that you understand, treat you with courtesy and respect, give you confidence in their abilities, take your pain seriously. You can see here, nothing here about satisfaction. Okay, it is, you know, did they listen to you when you talked? You know, or did they look around, were they distracted? Did they reach for some folder, open the drawer, answer the phone, and just tell you to carry on talking? Okay, so you can see that this is, you know, what are the kinds of things that we take seriously. Okay, give you confidence in their abilities. This is important. We'll cover it later on. A lot of clients or patients in the healthcare sector don't have a lot of confidence in public sector employees. And the reason they don't have the confidence is because the public sector employees don't give them the confidence. Okay? You know, private sector guys go out of the way to impress upon patients and clients about, you know, how experienced they are and how well regarded they are, because that engenders confidence in you. And if a client is confident in your ability, it actually enhances their experience and their outcomes. Okay? It's kind of called competence assessment by proxy. You know, in healthcare, or even I guess in social services, a patient doesn't have the skill set to actually assess and evaluate the competence of a surgeon. They don't. So they have to develop a proxy measure, and that proxy measure is actually based on what the surgeon tells them. Okay? So, you know, hi, I'm a foot surgeon. I've been doing this for 35 years. I do 5 of these surgeries per day, you know, and most of my patients tend to walk after 3 or 4 days. That's engendering confidence in the patient about yourself. So it's a proxy measure for them to assess and evaluate your competence. It gives them a sense of confidence. That's part of that positive experience they're looking for. So this is just gives you a sense of you know, some of the metrics that we measure. You can see what's ranked very highly. All of these are kind of, you know, in the high scores, but you can see an overwhelming majority of these measures are actually related to people. Okay, some of them are process measures. Now you can see one of the process measures that scores very highly is actually the ability to make an appointment. Okay, that scores very high. That's also a big, big issue in the public sector. You'll notice that for some reason, in most cases we don't take appointments, and in almost every other cases when we do take appointments, it's very difficult for us to stick to that, okay? So access is a big issue in the public sector. And access is something that clients and patients rank very, very highly, okay? More than that, a lot of the way we design our care delivery processes or our client-based services, we design it based on us. You cannot call yourself a client-centered organization if you design all your services based on you. That's the furthest from being client-centered that you can be. Now, I have the same discussion with healthcare, and they say, yeah, we are patient-centered. So I quote them a very simple example. Okay, if you're patient-centered, why must a patient get up at 5 a.m. to have a shower and have breakfast? How is that being patient-centered? That's being centered around you. Because the only reason that patients have to get up at 5 a.m., take a shower and have breakfast is because your shift changes at 7. That's not patient-centered, okay? That's centered around you. So if you're embracing this concept of being client-centered or patient-centered, it means you have to change the way you do things. You have to implement new processes and take into consideration the needs and wants of your clients. That's what client-centered means. It's not a phrase, okay? And a lot of people in the public sector, it's a catchphrase. We're patient-centered, we're client-centered, we're customer-centered. But when you actually study their operations, none of those are customer-centered. So this has implications. If you embrace the term, then your process has to talk to that. Now I'll give you a little anecdote. The airlines claim the same thing, is that, well, we're customer-centered. But if you take an international flight or a long flight, as soon as they reach 10,000 feet, they give you drinks and they give you your meal immediately. And then they switch off the lights and, the air hostesses go and take their break. They'll come back an hour and a half before you land and switch on the lights and, tell you to use the bathroom and give you your coffee and your breakfast, and that's done. And they're customer-centered. No, all of that is not based on being customer-centered. That's based on their work schedule. Okay, so it's just an example. It's not unique to healthcare or social services. A lot of the companies and organizations do that. But one of the airlines, Qatar Airlines, is in fact one of the airlines that I fly to South Africa on regularly, has changed that on its head. They are truly customer-centered because they don't prescribe to you what you can have and when you can have it. You can decide what you want to eat, drink, etc., and when you want to have it. All they say is just give us a 10-minute notice or a 5-minute notice before you need something, and so we can get it to you. That's the difference. Now, for them to be able to do that means they have to change their whole workflow from the traditional, as soon as you get in, we give you drinks, meals, pack everything away, we take a break, okay? But that's what it takes to become a world-class airline. It takes substantive change around and improvement of workflows, etc., to make that happen. So just bear that in mind, what true client centricity means. It is not a tagline. It means that you develop and design your operations around the client, not around yourself, and claim to be customer-centered. Okay? Good. So you can see There's a lot of components to this. The overwhelming majority, not surprisingly, is related to people and communications and empathy and authenticity and trust. Those are the kinds of things. Those are the kinds of things that we actually look for. And of course, you'll get this, and I'll post you the whole article from the Beryl Institute as well. Okay, next slide. If you have any questions, please feel free. Okay. So we'll talk about this more when we get into a high reliability organizations and operations management, because this is more about how do you actually implement, okay? Because if you're going to engage and embrace this pathway of optimizing client experience, it means you're going to have to do things differently. Okay, this means that you essentially have to change a lot of workflow, a lot of the way you operate, which means that you're going to have to conceptualize new ways of doing things. You're going to have to test to see whether they work. You're going to have to implement it. You're going to have to collect data, make the adjustments before you scale it. Okay, so that's this whole kind of client experience improvement cycle. It's a generic cycle. You know, some of you may be familiar with stuff like PDCA, DMAIC, Lean Six Sigma transformation, etc. So it's no different. It's just customized to managing the client experience. Okay, so bear that in mind. But we'll come back to this. I think your module 6, we start going into high reliability organizations, innovation-driven leadership, etc. And we focus more on the implementation. In fact, one of the issues that your deputy minister raised with me is we should consider adding modules on implementation science, etc., which I'm kind of in the process of thinking through and working through. So having said that, improvement cycles is something we will cover, and we actually have an expert on lean transformation who's also pretty much an implementation guy who will come and do that module with you. Okay, so I'm not going to spend any more time on this. We'll come back to implementation. Okay, so gaps in doctor-patient communication. Once again, you know, I'm sorry, but this is kind of the level of data we have. You know, unfortunately, only comes from healthcare. But look at some of the things that clients, or in this case, patients, suggest as being barriers to optimized patient or positive patient experiences. Okay, lack of warmth and friendliness on the part of the doctor. Okay, so this will be exactly the same for you. Okay, but you can replace the doctor with the social worker. Failure to take into account the patient's concerns and expectations from the medical visit. This is very important. You know, in fact, very few of us actually bother to ask our patients or clients, so what are your expectations from this visit? When you leave, what are the things that I should have done that will lead you to say this was a successful visit? We don't do that. It's because we are not client-centered. We know what is good for the client, and that's what we deliver. We make no effort to understand what the client really wants and what the client will actually perceive as a positive outcome from the visit. Okay? But it's a one-way, I have all the answers, these are the answers, this is the steps that you have to follow with it. Okay? That may not be what the client really wants. And remember, it's critical. If you want the client or the patient to be compliant, make sure that you answer their questions. Make sure that they leave the visit with the answers that they expected, okay? Because it's kind of almost not rocket science. If I go in for a medical visit with, you know, requiring answers to A, B, C, and D, and I don't get them, what are the chances that I'm going to comply with what my physician recommends? Pretty small. And so it's kind of logical, okay? Lack of a clear explanation. You know, we spend too little time on explaining to our clients what the causation is, amongst other things. And then we use terminology that they don't understand, okay? So these are just an example from research conducted. Now, I think social services would be pretty similar, but bear in mind, this is the kind of research that we need to start doing in social services. It doesn't exist, okay? If we're going to optimize the client experience in social development in South Africa, we're going to have to contextualize and get our own data and get a sense from, you know, our clients in terms of what they perceive as factors that either enhance or limit that positive client experience. We need to get that local data. You know, I don't want to be coming to class in future and using US or UK based data. We need our own data sets. And it's up to you guys to go out there and get that data, conceptualize these problems, you know, collect the data and present them to all levels within your unit, organization, province, region, etc. And publish them wherever it's possible so that it could be used to actually train locally as well. Extremely important. I mean, this is, as we designed this course, it was almost impossible to find literature around these specific areas that we designed the course in. Okay, so we can address that. Okay, next slide, please. Okay, so you can see this is another example of research, and this was from Thomas Jefferson University. And you can see here that the correlation between empathy and clinical outcomes. Okay? Now we can assess empathy, by the way. We can ask clients how empathetic social workers have been. We can ask clients how empathetic physicians have been, or any other public sector employee for that matter. You know, we can evaluate and assess the level of empathy. And by the way, you know, empathy is kind of to the extent that you can embed yourself in the patient's situation and feel for and with the client. That's what empathy is, and we can test that with a few questions. But what this data shows pretty compellingly is that people who are more empathetic, in this case physicians, their patient outcomes are far superior. Okay? It's to the point that I raised earlier on. So what is the business case for enhancing the client experience? This is another example of that business case, but using specifically empathy. So social workers who are more empathetic will have better outcomes and better compliance as it relates to their clients. Okay? And I'm not sure, maybe you can educate me, if you have any data, you know, that may suggest what the level of client compliance is. Anybody? Does anybody have a sense? Maybe from personal experience, I don't know. Anybody have a sense? Anybody have a sense? What's the kind of overall impression you have in terms of client compliance? Any ideas?
Yes, I'm working in the field of substance abuse.
Right.
And for us, looking at the client experience, we know that it's a relapsing disease, therefore they will have relapses. But I think for us, the challenge is that they don't go for aftercare services with the referring social workers. And that is part of our problem.
Yeah, but what's the root cause of that?
Experience.
What is the, so this is, go ahead, sorry, I'm interrupting you.
No, I think it's part of this experience that
yeah.
either they don't see the importance of going back, or there's no support from the referring social workers. Say, let me support you, let's make an appointment.
Absolutely.
The aftercare contact is not there from the employee side, from the staff side.
So I mean, you know, saying that they are non-compliant, we need to understand why they're non-compliant. Now you can look with this slide here. It shows you, in a case of a diabetic patient, that their compliance improves with the level of empathy from the care provider. So this is exactly it. If you have a suspicion that, there's a high non-compliance rate against substance abuse, I mean, we can't assume, well, this is the case in this space, in this group of people. May well be, but we still have to drill down and find out, well, what is the root cause, and to what extent does the client experience actually contribute to that? Now, I'm not saying it's going to contribute 100%, but I would be surprised if it is not a significant reason why they're not compliant, because the data, at least in healthcare, shows us that. Okay? You may be a great candidate to actually, understand this space better, because it's in, there's a good business case for social development to improve compliance in the substance abuse population. It's a major problem. I mean, it really is. And kind of tackling it superficially and not having a data-driven approach to tackling the root causes, I think will perpetuate the problem. It's something I think, if you can get together a group of people who operate, especially on this group of 213 who are in the substance abuse space and conceptualize stuff, you can reach out to me privately to help you shape a study. I can get the buy-in from higher levels, or you can do it from your respective leaders provincially and nationally, and I'm 100% sure you'll get support for that. But it's, we got to collect the data. There's just a paucity of data aimed at understanding root causes for non-compliance in the health sector. What I'm saying is that client experience is an important contributor to that. And ultimately we can only control what we can control. Client experience is something we can control. Staff experience is something we can control. To the extent that we can do that, I think we need to. Okay, so that's the whole point. This slide just shows, in the case of diabetic patients, those that perceive the more empathetic interaction with their physicians are more compliant. Okay, so you can see clearly there's a business case for this. Okay, next. Okay, communication is key. You can see this is a comment from a physician, and I'm sure, you will kind of appreciate this. I spent over 10 years becoming an expert at the science of medicine. Then I started to practice. Dealing with human emotion is the hardest part of my job, but nobody ever taught me how to do this. Okay? Remember, I said earlier on, both social development and healthcare at its core, you're in the relationship business. But the biggest caveat in our education and training is how do you actually manage that relationship. So, you know, all of us are technically competent in our respective issues, but we really grapple with the whole aspect of enhancing the interaction and, with clients and kind of developing this empathetic emotional connection with them. That is the key. And it's also happens to be the kind of tool, the missing link in what we do. Okay, so what I want to do now is, so you kind of understand what this patient engagement is all about. I want you to understand the difference between satisfaction and experience. I want us to discard the concept of satisfaction because it is a subjective measure. I want us to embrace the concept of experience because it's tangible, it's based on actual interactions. And I'll kind of share some of the kind of things, you know, that we ask. We don't ask you how satisfied you are, rate from 1 to 5. We don't ask that. For experiences, it's did the person A, B, C, you know, did they do this? Did they do that? Did they ask you this? Because it's, did you experience this? Not how satisfied you are. Did they greet you? Did they introduce themselves? Did they ask you if the lights should be switched off? Did they ask you if the curtains should be drawn? Okay? Not how satisfied are you with the ward. Okay? It's distinctly different. As a leader and manager, you can intervene if you know that clients are not greeted. You can intervene. You cannot intervene if you have an average score of 3 in terms of how satisfied are you with the interaction with our staff. If you get a score of 3 or 4, how helpful is that to you? It's not. Okay, but knowing that 70% of the patients are not greeted upon arrival is something you can address. So I want you to dispel that notion of satisfaction. Let's embrace experience. Let's work towards collecting the data on client experience and social development in South Africa at a provincial level. We can aggregate this, and it's going to give us, you know, rich data that's going to allow us to actually make tangible changes because we know what's not happening, we know what's happening. Okay? And that's very important because we know that a positive experience is correlated to positive outcomes. You know, it's much cheaper. It actually has positive outcomes from staff as well. So these are kind of important take-homes for client experience. And what I want to kind of go in now is give you some tools in terms of client experience and staff experience. It's kind of overlaps. You should treat your clients or you should treat your staff the way you treat your clients, okay? You know, there's really no difference in that. So the tools that I give you are just adapted to your client base and to your staff base. But the tools are exactly the same. Okay, so next slide. Okay, so tool 1 is called rounding. Now, I think I have another slide deck of rounding, but I'll give you the overview now and we come back. We can run through that and it will make a bigger difference, okay? Rounding actually comes from the ward rounds that doctors and nurses do. Now, you know, hopefully you haven't been in the situation, but some of you, you know, may have found yourself in hospital and you're familiar with these clinical rounds where doctors come around nurses and it's a clinical round. Okay, they're essentially, they may or may not greet you, but they'll pick up the file, read the file, blurt out instructions to the nurses and the junior doctors and move to the next patient. So it's a clinical round, okay? It's purely for medical purposes. So we've got the kind of terminology from there. And what we're saying is you can improve both the client and the staff experience by conducting these same rounds with them. Okay, so the tool is rounding. You round with your staff and you round with your clients. Okay? And what I want to do is take you through what that actually means, what's the shape and form, because it's very, very structured. Everything in this whole thing about patient is very, very structured. You know, you think about when you walk into McDonald's. You can go into a McDonald's in Durban, in Johannesburg, in Rustenburg, in Polokwane, wherever you are. The one thing that you'll find is constant, apart from the burger itself, is that customer experience. It's exactly constant. The way they greet you, the way they take the order, the way they ask you if they can upsize it or add something to it, the way they tell you to, you know, wait for your order, and what do they say after that? You know, whether it's enjoy your meal and please come back again. It's consistent irrespective of which McDonald's you go to, not just in South Africa, but across the world. Why? Because they have standardized it. It is all standardized. Now, in social services, social development, in healthcare, and especially in South Africa, it's very informal, and that's not really good. It's informal, it's subjective, it depends on the person. You know, they're pretty casual about it. There's no structure in the way they greet or talk to clients or staff, etc. If we're going to optimize the client and staff experience, we're going to have to standardize these things, okay? So that if a DSD client sees social worker A, C, and F, they should have a similar interaction with them. So irrespective of who they see and where in the country they see that, we should standardize it, okay? And in that process of standardization, we should be 100% sure that we cover the critical aspects that are important to both the clients and to us, and that lead to a positive experience. Okay, so bear that in mind. So even this concept of rounding, where we round with our clients and we round with our staff, we also standardize that as well. Okay, next slide. So essentially, this is what it's all about. It's about carving out time with, in this case, it's, you know, as I said, it could be clients, it could be employees, across your whole organization. And the whole purpose is to carve out some time, not a lot of time, to chat to them, to engage with them, to listen, develop the relationship with them, and kind of get a sense of what's important to them and what you can do to help them function well, both as patients or as staff, or clients as a staff. That's what the purpose of rounding is develop the relationship, get a sense of, you know, whether they're able to do their job well, what can you do to support them, what are the constraints, and who in the department is actually doing well that you think you should compliment. It's very structured. We'll give you the questions. The same with patients and the same with families. Clients, you've got to create a sample, a random sample of your clients, and round with them as well. You're not rounding to provide a service. You're rounding to get a sense of their experience with their interaction with you or your colleagues. So you're asking them questions pertaining to that. And especially in medicine and social services, I think rounding with the families is as important. Okay, you want to develop a relationship with the families. You want to reassure the families as well. You also want a kind of almost a collateral information in terms of whether you're fulfilling your responsibility to their family member, what can you do better, and also, you know, who's doing a good job. So as a leader, that you can actually thank them and maybe reward them. So that's this purpose of rounding. It should become a necessary tool in your arsenal where you carve out time to round with, you know, if you're in a leadership position, to round with your subordinates, to round with the clients, and to round with the families. This is part of your leadership functions from now moving forward if it's not something that you have done. It's something you can start doing tomorrow. Okay? Start rounding. It's actually extremely important. Okay. Next slide. So now this is why you would once again, you know, it's to inform the patient. In this case, it's in healthcare. Inform the patient. In your case, it's the client of the office's or organization's goal. Okay, that's one of the reasons you would round. Is what are you there for? What is your purpose? And so that I have a better understanding of expectations. For another reason is to actually manage staff. So if you're a leader, you know, and if you're communicating with the client, managing up means that you create a positive perception about your staff. The worst thing that a leader can do when they're rounding with a client is speak negatively or run down their staff members. Okay? That's a recipe for disaster. Clients lose trust. Their experience per se goes down, non-compliance rate goes up, and of course it results in inefficient services. So managing staff up, that's one of the leader's responsibilities when you're actually rounding with a client. Okay? You speak up about the experience of your staff pertaining specifically to this problem, the number of cases they deal with, their success rate, etc. So you're kind of engender this element of confidence in your team to the client. It's also, as I said, a competence by proxy approach. There's no way that a client can assess our technical expertise in this area. They can't assess that. Okay? But rounding helps us to create that competence assessment by proxy by actually telling the clients, okay, how experienced your staff is. Okay? It reinforces actions that support the provision of excellent care in healthcare, but I mean, you know, it's the same thing. You're trying to impress upon them all the things you do, and that makes you an excellent service provider. Okay? The other thing is to hardwire behavior, meaning that we actually ingrain these kind of behaviors amongst our staff, but also amongst the clients as well. You know, if you want them to be compliant, you would build it into that rounding with the family and rounding with the client themselves. Okay? It is to reinforce the behavior that you want them to exhibit. You use this rounding session to do that. Okay? I think we did when we spoke about leadership. It is around the purpose, and the purpose is this value creation. So when you're around with staff, you know, one of the key is to align the purpose. One of the big dysfunctionalities we have in the public sector is a misalignment of purpose. People's individual purposes don't align with the organizational purposes. And sometimes that's the task of a leader, is to drive that kind of alignment, you know, in terms of what we stand for, what we're here for, what is our value proposition, and how you can actually contribute to that as well. So that's just a few pointers on rounding with patients and staff. Okay, next slide, Debbie. Okay, so there's actually a, we'll kind of come to this. This is almost the kind of bullet points for rounding. You know, I'll go more into this: acknowledgement, introduction, duration, explain. So that's what we call ADET. It's very, very formalized. Just get this out of the way. So what I mean when I say scripted, it means that you don't round casually. Okay, you actually have specific things and specific approaches in the way you would do something. Okay, it's called ADET. We'll talk about that. Who's heard about ADET? A-I-D-E-T. Who has heard about ADET? Anybody? Anybody heard about ADET?
No, Prof.
No. Okay. So it's also like rounding is a critical tool. ADET is another important tool. Okay? And essentially, the A is for acknowledgement. I is introduction. D is duration. E is explanation. And T is thank you. Okay? Did you get that? ADET, acknowledge, introduce, duration, explanation, and thank you. Okay. That is a tool on its own. So rounding is a tool. I'll give you the scripts for rounding. And as you can see in all of these slides, a lot of the stuff starts with ADET. And you can see it here. It's acknowledge, introduce, duration, explain, thank you. What you have to understand is, and I'm going to get you to prepare your own ADET, is we've got to formalize the way we communicate with staff and the way we communicate with clients. There's too much of kind of casual approaches to communication in the public sector. And what I'm trying to get is to say, well, let's McDonaldize the way we communicate with clients, meaning that we standardize it. Okay? And ADET is a tool to help you standardize that. So it's kind of, you know, everybody should communicate exactly the same thing, not necessarily in the same order, but make sure that we cover these 5 components in our communication with clients and in our communication with staff. Okay? So what I would want you to do is actually develop scripts for ADET. How would I communicate with my client? How do I communicate with a staff member or somebody that reports to me? Okay? We need to kind of formalize these scripts. Okay? So the next slide. Okay, so these are just some of the key words when you're kind of rounding, and you can see when you're rounding with employees, you can actually see it's the ADET there. Okay? Acknowledge, introduce, duration, explanation, thank you, and then recognition. It's absolute. So those are the kinds of things. If you're developing a script for ADET for employees, your staff, these are the kinds of things you will do. You acknowledge them, you introduce. We'll come back to actually what acknowledgement is. But introduction, duration, closing, thank you, and then always recognize them for their work. Okay, so it just should become absolutely standard. And recognize good work, and if you think there are some shortcomings, you know, be diplomatic in the way that you would include that as part of your rounding with them. Okay, so absolutely critical. I've given you some bullets there. You can see reinforce the behavior and articulate why you're rounding. That's in now the previous slide. Knock on the door, address by name, ask for permission. So this is this formalization and standardization. Okay? Your name and title. Okay? I would like to spend a few minutes with you. Our goal is to provide you with excellent, how well are we doing? Thank you for your time, and please share feedback with me. This is all kind of scripted. It's very formalized the way we actually go about doing this. Okay, so I want to ingrain this kind of philosophy, this kind of rounding approach, because it's very structured. First, round with patients or clients and staff. Rounding is very formalized. Okay, there's a reason that we round, and there's a approach that we take when we round. Okay, we'll come back to more kind of detail on actual rounding and scripts, etc., as well as with ADET as well. Okay, let's go to the next slide. Okay. Okay, so from a client point of view, from a patient point of view, when you're rounding with them, these are kind of some of the things we do in healthcare. So how well are we doing in terms of keeping you informed? So bear in mind, you're a leader rounding on your clients. Okay? You take a random sample every day. Good leaders will always allocate 30 or 40 minutes a day to round on staff and to round on clients. Okay, if you don't have inpatients, but are we keeping you informed? Are we keeping your room clean? Are we explaining to you in a way that you understand, what's happening and what we're proposing, etc.? Are we explaining to you what will happen after you discharge from us? Are we managing your pain? Are we responding to your request for assistance? Are we addressing your questions and concerns? So it's a sample set. This is what happens in healthcare. Now we have to adapt that to your consultation, because these questions are pretty much similar. Okay, so one of the tasks I'll get you to do, like, are we keeping you informed, is pretty generic. Are you keeping your room clean? Could be switched to, our facilities clean, our consultation rooms clean, etc. Are we explaining everything to you before releasing you, etc.? So you can adapt this, but what you notice is that these are fixed bullet points. Everybody gets asked the same question. You cannot draw any inferences and any conclusions if you round with 5 people a day and ask them five people different questions. You cannot make any conclusions or inferences or improvements based on that. So it's a very scripted, structured kind of approach when you're rounding. Okay, so predetermine your questions and ask them exactly the same questions. Okay, next slide. Okay, so on clients, bear in mind that we put staff ahead of clients, so start rounding on them first. But when you are rounding on clients, you have to know their name. Okay, don't round on somebody that you don't know their name. So do your research, make sure you get all the details and know as much about them as possible. Because rounding is a way for you to get information about how well you are doing at managing the experience, how well is your staff doing, and is there anything you can do to improve that experience. So the client is actually doing you a service by providing you with that information and input on which you can base your improvements. Okay? Set time expectations up front. That's part of ADET. The D is duration. Okay, set time expectations in terms of how long you're going to be, and in the case of an intervention, you might want to talk about the intervention. Okay, how long that's going to take. Okay, it may take years, it may take months, but you need to give clients a sense of how long things will take. And one of the things that engender a lot of negativity, certainly negative experiences, patients just don't know, clients just don't know what their expectations are in terms of their time engagement with you. What's the duration of this? Okay. Focus the patient on the positive, or the client on the positive. I spoke to you about what's called managing up. You know, one of the things about experience is you want to engender a sense of confidence in you. So manage up your staff, manage up your organization. That's your job, okay, is to create this positivity around your organization and the staff, okay? And then finally provide that feedback with the staff. The whole purpose of rounding with your clients is to then summarize those findings and go back to the staff and provide them feedback. There is no point in rounding with clients or rounding with staff if you're not using that input. In fact, the biggest disservice you could do to your clients and staff is rounding with them, asking them if there's anything you can do to improve, and ignoring them. If it's the biggest no-no in leadership, okay? Requesting feedback and then ignoring it. That's a recipe for disaster. Okay, next slide. Okay, so as I said, ADET, and I think I have a slide deck on ADET and we can go more thoroughly into this. It's just an acronym. It's a pretty powerful way to communicate. It standardizes the communication, but does a lot of work to alleviate kind of anxiety, you know, especially with patients or clients who are vulnerable and nervous. This helps kind of break the ice in a you know, very professional kind of way. On the other hand, you know, as a staff member, you may have employees who are uncomfortable, especially very early on in their careers. There might be an element of discomfort in dealing with clients or with staff. So it's both ways, you know. If you think back the first time, if you were a practitioner or the first time you had a leadership position, and your first interaction with your subordinate or the client, it could be a pretty nerve-wracking experience. But if you had this ADET tool, it makes it very easy for you to engage in that interaction. Okay, so rounding is important. It's a structured way. You've got to round with clients, you've got to round with staff, and you would start the rounding with ADET, okay? Because it's this kind of structured way in which to communicate with people, okay? So pretty important. Okay, next slide. Okay, so the A in ADET is acknowledge, okay? The first thing you do is acknowledge somebody. Greet people with a smile. This is very important. Okay, you greet people with a smile. Use their names if you know them. I mean, you know, it's possible that you're walking down the corridor and you pass somebody. You may not know their name, but you can still use ADET. Okay, so if somebody that you know, if it's a client, hopefully you're rounding with them, you have their names. If it's a staff member, hopefully you know them, remember their names, but it's the same thing. Greet people with a smile. I mean, this is kind of obvious, but it's not done. Greet them with a smile, use their names, you know, first impressions count. That's a fact, okay? And ADET helps you to create a good first impression. You know, there's an example. Good morning, good afternoon, Mrs. Jones. I've been expecting you and we're glad you are here. Okay, so that's extremely important. And it kind of goes even further that your first acknowledgement of the individual should happen when they're 10 feet away. So 10 feet, I guess, is probably what, about 4 meters or something. I'm not sure, but you can get a sense of what 10 feet is. I call it the 10-5 rule. 10 feet away, acknowledge somebody. Acknowledge that you have seen them. So even if it's a smile, a nod, etc. And when they're 5 feet away is when you can verbalize something. Okay? So remember, a smile, acknowledgement, etc. when somebody is 10 feet away, and verbalize at 5 feet away. That's the 10-5 rule. And this is the kind of verbalization. Part of ADET is the verbalization, but that acknowledgement has to happen when the client or the staff member is at least 10 feet away. Okay? There's another one. Well, good morning, good afternoon, Ms. Smith. Welcome to, in this case, Albert Latundi. We want to make your visit as convenient as possible. Would you please take a moment to confirm that we have your most current information? Okay, so it's an example of acknowledgement. Okay, good. So bear that in mind. You have this. I'm actually going to ask you to write out your ADET scripts, but this is an example of acknowledgement. Okay, next slide. Next slide. Yeah. Okay, so the I is an introduction. It is where you would like to introduce yourself. Now remember, this is standard. Acknowledge first, and then introduce yourself. It's very formalized. Introduce yourself to others politely. Tell them who you are and how you're going to help them. Escort people to where they need to go to rather than pointing or giving directions. So what you want to do is give them your name, give them your title, give them your level of experience and your role and level of experience, and why you're the best person for them. Okay, that's the summary. In the introduction, once again, it's also a competence by proxy. You've got to make that client feel safe and secure with you. You've got to instill that level of confidence in the client. That frankly, I'm the right guy to help you, so just relax, okay? My name is Susan and I'll be conducting your test today. I'm a certified ultrasonographer and I do about 6 of these procedures a day. The doctors say that my skills are among the best. Do you have any questions for me? Can you see what that introduction is doing? It's creating the impression that Susan actually is well qualified to do what she does. She has corroborated that with physicians. So really, there's nothing to fear. I'm very experienced. Mrs. Kiepers, you'll be seeing Dr. Glomo today. He's an excellent physician. He's very good at listening and answering patient questions. You are fortunate that he's to see a physician. So this is somebody that may be at reception, but is using ADET because the client is going to see somebody else. So you can see it's the same thing, but in third person. You're managing up the person that's going to be interacting with the client, and you're once again engendering that sense of confidence in the client. Okay, this is what introduction is about. It's not, hey, I'm Ruben Pillay, thank you for being here. That's not what it's about. The introduction is an opportunity to create the sense of safety and confidence in you. Okay, and once again, as I said, I use this competence by proxy phrase, but this is the time that you should actually use that. So you can see those examples. It's pretty overarching. Okay, next slide. So you got the A, acknowledge. You've got the I, which is introduce. Okay, acknowledge is to make the client or the staff member feel special, that you know them, that you appreciate them. I is to introduce yourself, manage yourself up, give the client a sense of comfort, security, and confidence in you. And duration is about, you know, what is the time commitment that you expect from them? I mean, this is a important aspect of any communication. So if you're rounding with the staff member, you know, telling the staff member that, you know, this discussion is just going to be 10 minutes. It's pretty important. You know, so I can just get a sense of whether we are supporting you in your ability to deliver. But the duration part of it is critical. Now this is research. ADET is research, and these are the 5 critical components that people want in a conversation. So always have a duration component, the duration of your interaction, or the duration of their total interaction with your unit or department, okay? So Dr. Vilakazi had to attend to an emergency. He was concerned about you and wanted to know that it may be 30 minutes before he can see you. Are you able to wait, or would you like me to schedule an appointment for tomorrow? Okay? After the duration part, the client has a pretty good, the patient has a pretty good sense of the time implications and can make a decision based on that. Okay? So the duration part of it is critically important and has to be built into every conversation. Okay, next slide. And then explanation. This is whether you're rounding with a staff member, or whether a family member, or whether a client, you have to explain to them what is the process. What are you going to do, and what are they going to experience? You have to explain to them. And this is another big caveat in our communications. It's often, you know, one of the biggest shortcomings, if you speak to clients and patients, is they just don't know what's happening. Okay, we don't keep them informed. So it's critical as part of ADET that you actually advise them on what is actually going to happen now and moving into the future, and of course build in that duration part of it, okay? Is to advise others what you're doing, how procedures will work, whom to contact if they need assistance, communicate any steps they may take, you know, that kind of stuff. So, and at the end of that, is there anything else I can do? Okay, so there's an example. The test takes about 10 minutes. The first step is to drink the solution, and then we'll have you wait 20 minutes before we take a blood sample. Would you like to read while you wait? Okay, so this is scripted. You've got to write this thing down, learn it for all the conditions, and you formalize this. Now, ADET, you know, it's a guidance. We need these 5 component parts in there. But, I mean, you know, you can integrate duration and explanation in one. I mean, obviously, you can't start with thank you and end with acknowledgement, but you have some flexibility in the way you write out your script, okay? But these 5 components, so when you're reading your script, does it have these 5 component parts in there? Okay, that's the key. We have to formalize it as units, as organizations, as regions, and as provinces, and nationally as well. I think we have to embrace ADET. It's something that I'm pushing in a big way for the Department of Health, that they need to embrace ADET. Okay? And one of the leadership functions is actually to make sure that ADET is used. So observe. You have to observe your staff, whether they're using ADET in their interactions and communications with you, in their interactions and communications with their colleagues, in their interactions and communications with their clients. So one of the functions is for you to put systems in place to actually monitor whether people are using ADET, you know, and insist on it. So it's one of the things you will assess when we assess client experience, because we ask the clients, did they greet you by name? We're not asking, were you satisfied from 1 to 5 on your admission process? That's not what we're asking, because you know satisfaction is subjective. Were you greeted? Were you greeted by name? Did the staff member introduce themselves to you? Did the staff member explain to you their qualification to actually manage you? Did the staff member mention to you that the time it would take? Those are yes and no answers. Their experience. I'm asking them their experience, but I'm using ADET. So we can actually go back, and then you go back to your staff when you got the data and you say, well, 70% of the patients say that nobody explained to them how long it will take, this interaction. It's something we can change, okay? So it's pretty important. When you implement it, you've got to track it and monitor it and constantly make sure that it's implemented. Okay, next slide. Thank you. So this is the T part of ADET. Okay, you thank somebody. Okay, foster an attitude of thank them for their patronage, help, assistance, service, or whatever it is. You know, if that's a client, if it's your staff member, you know, recognize their efforts positively. Thank you for choosing our clinic. It's been a privilege to care for you. Thank you for your call. Is there anything else that I can do for you? I have the time. So always, you know, end with a positive. I like to call this an ADET plus a promise. Okay, so you can build a promise into ADET. From a client point of view, you can promise excellence in service. From a staff point of view, you can promise excellence or in terms of the support you can give them. Always build in a promise of excellence. Okay, it's just something you can add in that makes a very big difference. So you can see a simple, you've got two tools now. It is rounding and it is ADET. And ADET is part of every rounding. Okay? So from a leadership point of view, you actually can implement these two things immediately. You know, carve out time to round with staff members and to round with, you can't do everybody all the time, but you should make a decision that if you have 10 direct reports, that you will round on each one of them at least a week. You will round on a sample of clients, you know, a random sample, an X number of times a week. And great leaders carve out time every day to round, because this is giving you information on which you can actually act and on which you can actually lead. Okay, so it makes sense that you carve out time in the day to do that. I think it's a critical leadership function, rounding. The other thing important is the ADET concept. Remember, it's a communication tool that we need to standardize throughout DSD. I mean, everybody needs to communicate in this way. It also engenders a sense of confidence in yourself. I mean, I think, you know, you become more confident in communication, you know how to open a discussion, etc. And write this down. You got to write this down. If you have to write it down and memorize it, so be it. That's what you need to do, okay? I know all of you are working together in groups, so write down your ADETs and share it with your group members. I'm not giving you a formal assignment, but that's something you can do. You know, write down your ADET and pass it along for others for their comments, and they can critique it and send it to you until you have something, you know, reasonably polished. You'll have two ADETs, one with staff and one with clients. Okay, so that's some work for you. We'll come back to this. I'll come back to ADET now and give you more granular information, but for now I think that's fine. Okay, so your next slide. Now in the US in healthcare we do what's called the CAP survey. Essentially it's something that I want to replicate in South Africa. Now in healthcare we do the survey to assess and evaluate patient experience in healthcare, and we split it up into ambulatory or outpatients and then hospital or inpatients, and we assess patient experience, you know, at several levels. Even before the patient has made the decision to come to you, you know, we're asking them, was it easy to get information about us? You know, that's important. We can't just assume that people know where we are. So it starts there and it ends when the patient has made 100% recovery. Did somebody follow up on you a day after your discharge, a week after your discharge, a month after your discharge? Okay, so the CAP survey is something that we do to test experience. This is something we can develop for DSD in South Africa. Remember, in the US it's important because 10% of the hospital's remuneration is at risk based on scores on patient experience. It's something I want to introduce into South Africa, especially as I said, as we roll out the NHI, is we just don't pay hospitals for every procedure or service. It's the service plus the patient experience. I think DSD can go the same way. This is how we're going to improve the services, full stop. We have to prioritize client experience. We have to put the individuals and the organization at risk if they do not provide that level of client experience or staff experience that we require. Okay, so that's kind of a summary of what client experience is all about. We've got, you know, you understand what it is, you understand the difference between satisfaction and experience. I remember it's a big difference. You understand what the imperative is, why is it imperative, and that's because of the positive correlation between experience and outcomes and business efficiency. You have two tools, rounding. You round with staff, you round with clients, and then of course you have ADET. ADET is embedded in rounding as well, and is a communication tool. And you know, it is shown to positively enhance communication, reduce anxiety, and all of those things. So two working tools that you have. Okay. Any questions before we take a short break? What's the time, Vic? 11:52. We're almost at 12. So any questions before we take a lunch break? Any question?
Question?
Yeah.
Rob, I would like to know, do you think that sometimes it's better to have an anonymous type of survey, or is the direct one-on-one?
No anonymous.
The reason why I'm asking is a few years ago I was involved in secret consumers surveys.
Right.
Where especially the retail businesses, etc., would then send the mentor or the assessor a questionnaire,
Right.
and then you go, for instance, to Nando's, they will then, you go and order something, sometimes you have to do sit down, sometimes a takeaway, and then what they would do is, afterwards you will have to complete the questionnaire about the acknowledgement while you were in the queue, where you acknowledged, when you got to the center, did they greet you, did they spy, all kinds of things. But it was done anonymously, the staff didn't know that you were part of the team assessing them.
Yeah. No, so the client experience and the staff experience instruments are obviously big surveys that are anonymous. Rounding is personalized, because you're also rounding to support somebody and to understand their pain points and what you can do to alleviate that. So it can't be anonymous. You know, the same with clients as well. So Yeah, but the full surveys would generally be anonymous if the person chooses to be anonymous. Yeah, it's very, very different to. So I know exactly what they do in the fast food industry and a lot of the service industries is, what do you call them, secret shoppers kind of thing. You know, yeah, we don't do that. I mean, the equivalent of that is creating a fictitious client or a fictitious patient and walking through the system. You know, it's not something that we do in healthcare or the social services, but whether that would work or not, I'm not so sure. But it's a possibility, but it's just not what we do. You know, we don't have secret patients and secret customers. We just, you know, for me, rounding is for me, anonymous surveys or anonymous assessments don't really help because you can't customize that feedback. You know, so if you get 10 anonymous critiques, how do you respond? You know, so one of the things you're also trying to do is create this culture of transparency within your organization, amongst staff and with clients as well. So we talk a bit more about this in the next module about a just culture, where you actually, part of the function of leadership is to create this just culture. Means that, you know, there's no blames and there's no accusations, and that problems are blessings, that complaints are blessings. You know, we don't attribute anything to anybody specifically, but we create this context where clients should be able to talk to you about poor service, and your colleagues should be able to talk to you about poor service, non-performance. That's kind of my personal take. I think that transparentness, that openness, says a lot about the culture and the way you do things. But to be honest, I mean, you raised a really important point, something that I have not thought about. But I mean, if you're a leader and want to you know, want to test whether your staff is using AIDET, then I guess you can send somebody in there to masquerade as a client, you know, but I really haven't thought through that, not sure about the ethics behind all of that, etc. So, but good point for a discussion. I really haven't thought about it, to be honest with you. Any yeah, right, interesting point. Let me think about it now that you raised it. Let me just think about it and see. Okay, any other questions? So before you go for lunch in 3 or 4 hours, in 3 hours, you kind of should have gathered a lot of information. The amazing thing about this is pretty simplistic. It's not rocket science. Nothing that I said to you this morning is really groundbreaking. In a way, it's so simple that it's kind of logical. It's very easy to implement. Okay, so you know, we know difference between satisfaction and experience. We know the imperative for measuring experience. We know 2 tools to enhance staff and client experience are rounding and AIDET. Okay, I've given you the basic overview of rounding. I've given you the basic overview of AIDET. Okay, we'll come back now and drill a bit more down on AIDET and rounding, and you know, speak a bit about managing up, engendering that confidence and positivity in your organization, and then we'll round up. Okay, so is 30 minutes okay for lunch so we can get done earlier? I can get you away on your early, what is it, Labor Day? I even lost track, yeah. 30 minutes, good? Hello?
Yes, bro.
Okay, so what's the time?
Fine.
Yeah, what's the time? It's noon now. Come back at 12:30 and I'll try and get you out by 2:30, 3 o'clock, okay?
Right.
Okay, yes.
Thank you, Prof.
Bye.